sense? So we look at these numbers. These are most often odds ratios in parentheses. A 1 means that people are equally likely. So if we have withdrawn behavior and came up with a 1 there, it would mean that people with hunger and people without hunger are just as likely to experience withdrawn behavior. We don't. 1.74, we could say is about 74% more likely. And you wind up with some of these other odds ratios like 7. It's huge, which you'd kind of expect, right? A kid goes to school and he's hungry. What's he going to do? How's he going to react? Withdrawing is a good idea. One of the things that we know is how does our body use nutrients? Right? The frontal lobe is probably the last thing to receive nutrients. The body's going to take care of vital organs and all kinds of other stuff. And if you use that frontal lobe for kind of interacting in psychosocial work, that doesn't happen. So you'd expect some of these things to occur. So what these costs reflect are the costs attributable only to hunger of that particular condition. Okay? So if we look at depression, and I've combined depression, anxiety, and suicide into one amount because for the case of this presentation, what we see is people that are hungry are 3.5 times more likely to be depressed than people that are not hungry. So what's that 3.5 times more likely? When you look at all the costs of depression in the U.S., which I think Harwood actually came up with the total cost of depression to society in 1998, I think was a study, right? That's everybody, hungry or not. What portion of that cost will we say is because of hunger? Because even if that person's not hungry, they still will have a likelihood of being depressed. So we want to know that difference. And that's where the calculations kind of come up in identifying this. So we have the total cost of depression for everybody, hungry or not. We have the likelihood of depression because of hunger. And from that, we can calculate the cost of depression only because of hunger. Does that make sense? Okay. All right. Come up with $66.8 billion. Now, there's a couple caveats to this, and there's a couple reasons why this is a lowball number as well. One of them is if you notice the areas where there's 2 stars, upper GI, other hospitalization, and excess cost of fair or poor health status, one of the things that we found in literature is that people that are hungry are more likely to report fair or poor health status. No, it's not necessarily a huge surprise to anybody, I'm sure. What we have is we have 2 different kinds of costs, as you might identify them, which are direct costs and indirect costs. So when we think about health status, direct cost is the hospital bill, is the doctor bill. The indirect costs would be things like missed days of work. Some studies will use transportation, but some studies won't. It's the cost to the family of that particular condition. Okay, so what's the cost of the family? If you can find a good study that's able to calculate, what's the cost of a child going to a soccer game without their father there? There's a cost to that, right? We don't know what that is, but there is a cost. So with those last 3, we were unable to identify studies that had indirect costs. We don't know what the indirect costs are of upper GI disorders, other hospitalizations, missing work, pain and suffering, all kinds of other stuff. We use MEPS for that, the Medical Expenditure Panel Survey or something. That's great. Dental care is a huge, huge area that we're just starting to realize, and we see this in behavioral health as well. What we know, for some reason, as researchers and even as clinicians, we're just noticing is that people with dental care problems can't eat properly, but also are more likely to relapse into substance abuse if that's an issue for that person. Why this is a surprise, I'm not sure, but we're just now starting to head in that direction. It's very progressive, and kind of bringing that piece up. You're absolutely right. For some of these, even when we estimated indirect costs for some of these other things like iron deficiencies, we were still very conservative in our calculations. We always kind of went with the lower numbers whenever we found them. We wanted to be able to securely kind of support our efforts here. And just like what was just pointed out is we didn't cover things like dental care, the cost of surveys, or the cost of other things, because we weren't able to identify studies that way. Because don't forget, we have to identify that that dental problems are a consequence of hunger, and then do we have a cost related to continued dental problems. Both those things have to occur in such a way that they control for other issues. Okay, so this is kind of this 5-step process that we were talking about before. The last area that we looked at cost was limited learning, the cost of lowered economic productivity. One of the things that we know is that hunger has an impact on cognitive function, on social interaction. It has an impact on education, to include low school performance, a higher likelihood of failure, a higher likelihood of being held back and to drop out of school, and it also has an impact on subsequent employment. This was a very, very difficult area to measure. You know, when we think about kind of the cost of lowered economic productivity, this is a very, very difficult thing to measure. And we're not necessarily able to capture all of this. When I say that, what I'm talking about is again, a lowball kind of number. When we think about a child that's held back, what is the economic impact of being held back? Right? And that economic impact could last for the rest of that child's life. Right? Controlling for other factors. A failure. Right? What we were able to do was identify a few studies that were showed kind of missing hungry children are 1.6 times more likely to miss days of school, 1.10 times more likely to experience school suspension, and 1.44 times more likely to repeat a grade. So these are the problems that we were able to identify, had a research basis to include in our study. To identify costs related to these, again, what's the cost of a school suspension? You know, you can play with this in your head for a minute. You know, there's a lot going on there. There's the cost of the school, right? The school has to have a person in the class or a person monitoring this kid running around town or whatever the kid's going to do, right? The parent might have to take a day off from work, or a relative might have to take a day off from work. And there's sometimes 2 jobs in the same day, right? If it's an in-school suspension, you have to hire someone. You have to have a space for that student. And what's the effect on the kid long term? We come up with $9.2 billion, which is, again, a fairly conservative number because what we're able to find for costs revolved around absenteeism, grade retention, and dropout. It's very conservative because we just can't quantify all of the mechanisms in which hunger may lower productivity. So what we weren't able to measure were things like what's the impact of hunger on a mother, for example, or a father who hasn't eaten enough for breakfast when they go to work, right? What's the impact of that presenteeism that we're kind of identifying more and more as folks work more and more hours and more jobs, and they're at work, they punch the clock in and out, but not necessarily able to kind of perform to the best of their abilities. We weren't able to capture that at all with this. And especially, when you think about some of the folks that I work with around this issue is, when I worked in clinical social work, it's frequent to kind of meet parents that are working 2 or 3 jobs. And I'm always shocked by the 3 job. I'm always shocked by the 2 job thing. I barely work 1 job and I'm tired all the time. I can imagine, doing 2 or 3 jobs. And parents do, I think many people do it. And so we're not capturing that. So in the end, what we have is our total bill. When you sum each of those areas up, we come up with $90.4 billion. And this is a pretty substantial bill. This is kind of, when we think about, this is private and public costs. So this cost affects all of us, especially when we look at the way I calculated this. When you look at how this compares to other conditions that I presented earlier, we see alcohol abuse about $185 billion, smoking at $138 billion, hunger around $90 billion, obesity $79 billion, and drug abuse $161 billion. When I say $90 billion too, I also mean $2005, even though the publication is 2007. Just want to be clear on that. This is again a very conservative amount. We feel like the amount is actually much higher, and we've excluded several components. And the majority of it had to do with not having adequate research to support their use in our calculations, wanting to remain conservative. We wanted to make sure that if someone wanted to thoughtfully blow a hole in this, we were pretty tight with things, and we clearly stated our assumptions, and that was important